Good evening, everybody. My name is Sanj. I'm one of the board members of the NPA. So I'm just going to give us a few more minutes just for a few other attendees to join, just give them a chance to join on the webinars. We've just hit 7 o'clock. So I hope everyone is doing all okay. And firstly, to start, thank you for joining us on what is a lovely summer's evening. So you've all given up your time to be here. So really, really appreciate that. And hopefully you'll get some really valuable insights into what webinar, what we can offer through tonight's webinar. And then after that, we're hoping to just be maximum about an hour, and then you can nip outside, enjoy the weather, top up your suntan. So hopefully not too long. We won't keep you too long, but it's a fantastic webinar tonight. What we have got some three great guest speakers here this evening. So we've got Gary Howard and Lauren Purcell from NPA Connects and Jan Trepp from Kwai. So they're going to fill you into a little bit of what they can offer and how they can support us as pharmacists, your patients, how we can care for our patients. And actually what we're all struggling at the moment is trying to think how we can maximize our NHS services, expand our breadth of services, and like I said, how we can support our communities, build awareness of what we're doing. And this is what tonight's all about. So what I'm going to do is start off by handing over to Gary, who will give you a bit more information about NPA Connects, what they do, how they work, and how they can help support you, and how they're working with Kwai to really increase engagement within the community and increase awareness about high blood pressure. So without further ado, Gary, I'll hand over to yourself.
Thank you very much, Sanj. Hello, everybody. And again, I reiterate Sanj's comments. Thank you for taking the time to join us this evening. And we hope you find this really interesting. So basically, just to give you a top-down view on what NPA Connects is all about. So it's a set of tools and services that enable community pharmacy to build awareness within their community. So give them the tools to enable them to reach those people that are very important to that local pharmacist. What we're also trying to do, and a big part of tonight's presentation, is around how we ensure that all stakeholders take part in that process, so that putting the pharmacist at the very center of the communication, but also helping them reach those people through support, sponsorship, and the like, but also through their product offering. And so we're delighted to introduce Kwai blood pressure into this process tonight. And they have at the end, Lauren will describe how we're going to be running a program so that you can reach households, 100 households around your particular pharmacy, and the process of doing so. But hypertension is a real problem. Hypertension across the UK is a real problem, mainly because there's still a number of people that do not know that they're wandering around with high blood pressure and the problems that can cause them. And so building awareness around that, especially at this moment, is huge. The message coming from their local pharmacy is one that can be trusted and understood much more effectively, more so than a national message. And so that's what we're really looking to do, the kind of assets of that local community. So NPA Connects is really being designed for pharmacy. And so we would like to build it in your guise, really. We want to make it transformational. We want to make it so that you have the same tools and the same power at your elbow than some of the bigger kind of branded chains. And to do that, we want to bring all independent pharmacies together in one web service, and so that you benefit from each other's reach and each other's purchasing and each other's kind of power, really. And if we look at it as an asset, having 6,000 members as the NPA do, that can reach a huge proportion of society, of the population within the UK, all within a walk distance of each and every pharmacy. And with the push to deliver private services, paid for services, such as weight management, smoking cessation, travel clinics, all of these key things that people really do value and value the convenience of that service. We just need to build awareness of that. And so we want to champion your pharmacy and also build your brand within that community. And so it's about heroing the pharmacy as the solution to some of the issues that we might be having as a population, and making sure pharmacy first and the message behind Pharmacy First is delivered in the most effective way. But we realize that we need everybody to take part in this and every stakeholder to take part in this. And that is why we're very keen to work with partners such as Kwai Blood Pressure. And it's and I'm delighted to introduce you to Dr. Jan Trepp, all the way from sunny Switzerland, by all accounts, introducing a bit about Kwai as a product, and also what they're going to do to help support pharmacy in the UK. Get that message across around hypertension. So Jan, without further ado, welcome.
Oh, thank you very much, Gary. I'm honored to be here, part of the NPA Connect program, to present you and talk more about Kwai blood pressure management, and the role of key micronutrients. Just that you are aware, I'm not in control of the slides, so that's with Gary in the UK, as I'm only from Little Switzerland. So whenever I say Gary, it just means that he has to switch to the next slide. I'm not saying anything odd to my colleague over in the UK. So what are we touching on tonight? So first of all, I'm talking very briefly a little bit about Kwai, what Kwai blood pressure is, what Kwai as a brand stands for, why blood pressure in the UK is, or high blood pressure is potentially an issue, what is the role of the pharmacy in managing high blood pressure, why do we believe that we have a very good solution in Kwai blood pressure to manage a certain portion of the population with certain issues with high blood pressure. So what is the scientific evidence behind it? And then we're also trying to help you to show you how you actually can recommend such a product in a pharmacy setting. And then that is all embedded in the overall NPA Connect strategy, which actually it helps you to position your pharmacy better in your community and to serve the population with those specific problems. So now, Gary, next slide. So we need to go to the next slide. So I'm here, part of Precision Healthcare. We're a sister company of Precision, which is also part of the NPA Connect. We are located in Bury St. Edmunds, in lovely Bury St. Edmunds, also very sunny, as I can see in the background. And we are a company which offers a range of natural complementary health products for specific health needs, such as in the event or in this case of Kwai, blood pressure, but we also have OTC products such as Kira, and then essential oils such as Clearwall for inhalation. So we are actively nationally and internationally, and we are expanding in various different markets. Gary, next slide. So Kwai, I have known this brand for a very long time, even if I look very young here on this, camera here, because NPA has done such great job to make me look good here. I have quite some years on my shoulders. Therefore, Kwai is one of the leading heart health products in Europe. And it's very well known. I think the ones of you who know Kwai are associated mainly with garlic, Kwai garlic, Kwai heart care, which has been around for over 38 years, and which is actually still today the leading heart supplement in Europe, and that's also backed by clinical evidence. Actually, we just looked the other day of about 32 clinical studies which have been conducted over the last years in garlic. About 26 have included Kwai. So that's quite a strong, let's say, clinical backed heritage which we can let's be proud of. But tonight we're talking about a completely different product, which is Kwai blood pressure, and the formulation obviously is different. This doesn't include garlic, but this is just where we come from. So Gary, next slide. So this is where we just jump straight into the problem. I think both Sanj and Gary touched on it earlier. High blood pressure is a major health issue in the UK, and here is one of the reasons why this is the problem. About 40 to 50% of the UK population have high to normal, let's say up to stage 3 hypertension. And many people are not aware that they suffer from high blood pressure. And this is one of the reasons why over the last years the NHS has introduced that pharmacy screening program for high blood pressure, or for blood pressure management or measurement in general in the pharmacy, because they're really concerned about the effects, the long-term effects high blood pressure has in the overall population, and the increasing cost in healthcare management this causes if that goes unnoticed. Next slide. So this is why actually this is relevant for the pharmacy, because hypertension is a leading health issue, not only in the UK, but actually worldwide, also in Switzerland. And the pharmacy can play a key role here in doing screening work, and then doing, let's say, the first line treatment for the patients which are in certain risk groups, and we come on this later, where maybe supplementation is something which people can benefit from. But also, today's patients seek natural solutions as well on top of medications, and who is better posed than the pharmacist to make here a very good recommendation which does not interact with the medications people are already taking. Next slide, please. This obviously also brings you some commercial value, especially if you're an independent pharmacy, because the awareness in the public for hypertension is low. There are increased efforts of the government, NHS, to bring patients to the pharmacy to do the screening, and the independent pharmacy becomes here the, let's say, the heart of the community frontline preventative care for to manage the high blood pressure epidemic, let's say, which we are facing today. And also there is an opportunity for you to make some revenue due to the blood pressure measure checks you can do, but also there is an opportunity to do some cross-selling where it makes sense, supplements such as Kwai blood pressure or blood pressure monitors. Next slide. So then we come to the bone of my part before Lauren goes actually how the whole campaign works. So what are the ingredients in Kwai blood pressure, and how do they actually work? And here on this slide, I'm just showing you in a nutshell what the key ingredients are and what is the evidence behind, before I dig some, let's say, in some more detail behind it. So the key ingredients here, very straightforward: potassium, magnesium, zinc, B vitamins, and iron. And the ones which I will show you in some more detail are potassium, magnesium, which have besides also the others here, an EFSA claim on heart health, and in the case of potassium, also blood pressure. So it's very well established and very well documented that those minerals and vitamins do have a beneficial role in contributing towards blood pressure regulation and heart health. Next slide. So for us also, and from my background, I'm also a scientist, I'm a biochemist. So what we do all know is, and what it says on all those food supplement products which we are selling, food supplements are not a substitute for a healthy, balanced diet. Therefore, what I want to show here on this slide is basically the most important is the middle column here is the target dose and what your typical daily intake should be. And what we are all aware is that most people, if they would have a balanced diet, they could very well take it through their normal diet. They wouldn't need to take a food supplement. However, there are certain groups of people which have poor diets, for example, those who take a lot of or have a high intake in processed foods. But one thing we should not also forget, the older we get, the less you basically eat, and also your absorption for certain vitamins becomes lower or worse because we're not made to last forever. And one effect also has to do with the absorption of certain minerals and vitamins through your intestine into the body, and that's where supplementation starts to make sense, or at least should be considered. Besides, let's say, to advise the patient to move towards healthy lifestyle, healthy diets, balanced diet. Next slide. So we come on the key ingredient, or the two key ingredients. The first one in Kwai blood pressure, which is potassium. So potassium has been very well studied over the last, let's say, decades, several decades actually, in fact, and it's very well established that potassium has an effect lowering blood pressure, both systolic and diastolic. And here I'm just showing you the results of a meta-analysis which included over 2,600 patients, and it very clearly demonstrated that there is an effect on potassium on blood pressure. So this is especially the case when dietary sodium is high. And dietary sodium is high in patients with, let's say, poor dietary habits. So we're talking, again, processed foods, maybe a lot eating out instead of cooking yourself, etc. That's where you can have an issue through dietary sodium intake. Next slide. So how does potassium work? So what I mentioned before, it enhances sodium excretions, very important, but also it reduces the smooth vascular tone and decreases vascular resistance. It's meaningful with a patient population with a low baseline potassium intake. As I mentioned before, has to do a lot with people eating a lot of processed foods, poor dietary habits. However, it's less effective, and there is a risk with people with CKD, chronic kidney disease, where you are well aware that the potassium-calcium product can be causing an issue if you have an imbalance in potassium intake, and could cause hypercalcemia. So that could be a dangerous condition. However, I should say, remember, the amount of potassium in Kwai blood pressure is about 350 milligrams, which is about 10 times below what is actually recommended to be taken in daily. Next slide. Then we come to the second key ingredient, which we have, is magnesium. Magnesium supplementation shows also a clear effect on blood pressure, both systolic and diastolic. And there's also a very clear dose response pattern. So the higher the magnesium level, the lower the blood pressure. Let's say there's also to a certain effect, but there's a dose response pattern involved. This is also the results of a meta-analysis, including more than 2,000 people. This also then led EFSA in the European Union to give magnesium a claim on heart muscle, the benefit on heart muscles. Next slide. I think that's still the same slide, Gary. Here we go. So the benefits of magnesium, it reduces, so patients with mild hypertension. The mode of action, it is a natural calcium channel blocker. It promotes vasodilation, improves arterial compliance, stabilizes cell membranes. It's meaningful with people with low serum magnesium. That means also here you have individuals with, let's say, poor dietary status. So you need to improve that with giving supplementation. That also it's less meaningful with people which have adequately dietary status. That means they have a healthy diet. It's probably less meaningful to give them a supplement in general. And they also should have sufficient magnesium through their diet. Next slide. Here on this slide, we're just showing you the overall summary of the ingredients in Kwai blood pressure and their effect on blood pressure, how it works, where it's meaningful and where it's less meaningful. We haven't touched on the B vitamins. B vitamins typically have an indirect effect on blood pressure because they work through different pathways. They are less meaningful with well-nourished individuals. And then the other very interesting ingredient, which I haven't touched on tonight, is zinc. Zinc has a direct impact on blood pressure if you have a zinc deficiency. So if your zinc levels are normal, that is not a problem. But zinc normally plays an important role in blood pressure as well. This is very well evidenced through the literature. We have, just for if you are curious, for all those claims, in the end, if you get the presentation, there is a list of references attached to the presentation. And so if you then need some one or two of those presentation references or papers, just let us know. We're glad to provide them to you. Next slide. So how to recommend Kwai blood pressure in the pharmacy setting. So as I mentioned before, I'm a biochemist, I'm not a pharmacist, so I don't see patients every day. And I also live in Switzerland, so I'm less familiar with the NHS, but all my colleagues from the MPA and from Precision have taught me here this lesson. So as you are, and I think you're much better aware than I, there are certain eligibility criteria in the UK for the NHS blood pressure service and how you can get paid as an independent pharmacist. So there are several group of patients which are admissible and not. So let's say if you are older than 40 years, if you are 35 to 39, or let's say older 35, but you have family history, or very interesting, if a GP clinic refers a patient for blood pressure check to the pharmacy. Not eligible are if you are already diagnosed as a patient with high blood pressure, or you're under monitoring, or you have some, let's say, already heart conditions which you need to be taken care of by a doctor. Next slide. So where do we think actually supplementation would make sense? So we see that in 3 groups of patients. Probably you remember what I have shown you before, the different categories or different categories of blood pressure. You have the optimal normal, and then you have stage 1 through stage 3 hypertension. And let's say people who have a normal blood pressure, you probably just want to give them some lifestyle advice in the event there are certain, let's say, points to consider where they can make some improvements. But there is actually not really supplementation needed unless there are certain risk factors are present. If you have stage 1 through stage 3, of course, you just refer the patient to a doctor, which then goes through the further diagnosis, formal diagnosis, and then see what the doctor probably prescribes or recommends to the patient. Then we have a group which before we saw it's about 20% of the people, of the population, which is normal high blood pressure. And these people are what we call, they have elevated blood pressure, and their lifestyle advice and optional supplementation actually makes sense, or could make sense, if certain risk factors are not present. And we come to that on the next slide. And their supplementation actually could make sense, especially if they are above 55 years of age, where we all know that the absorption for certain vitamins and minerals actually decreases. And also people have or start to eat less than when you're young. When you're young, you need more calories than when you are older in a typical case. So the risk groups eligible for supplementation, if you have high normal blood pressure, is the age, so above 55, the weight, Do you smoke? Do you have excessive use or use excessive alcohol? You have low physical activity, high salt diet, that means processed food. Do you have, let's say, low veggie intake, or you are, let's say, an elderly patient? On the other hand, supplementation can be an issue. Let's say, okay, pregnant breastfeeding is most of the time, let's say, the very common factor we can exclude. But if you are really you have a very high, or you have really hypertension, so you have stage 3 or 2 and 3, but also chronic kidney disease patients or patients with heart failure, we would not recommend that you recommend supplementation there, or history of electrolyte imbalances. This is where I would be more cautious. But on the left-hand side, these risk groups are very well eligible for supplementation. So this is in short, the benefits of Kwai blood pressure, how the product works, how can you recommend that in the pharmacy, and then I think Lauren or Gary probably will show us now how that works together with the MPA Connects program, and I'm very happy to hand over back to Burries and Edmonds. Yeah, here I forgot the key questions, but we'll move back to them.
Jan, do you want to do this one?
Yeah, I just showed the key questions. So the health screening questions, basically it's a deviation of the slide before. So, have you been ever diagnosed with blood pressure or high blood pressure? Have you taken any medication, kidney heart problems, breastfeeding, etc.? And then you have I think these are the most standard, I would say, but I think for me, the most interesting are more towards lifestyle risk assessment. So, do you eat fresh foods or vegetables? Probably we could also ask, do you cook yourself? Do you eat processed food, salty foods? Do you eat a lot out? Do you go out? Exercise is very important. We know that. So if you do your 10,000 steps a day, that has an effect on high blood pressure. Then you smoke and alcohol obviously have a big impact. And then the last question is, do you already take vitamin or mineral supplements? This is important because I think a lot of people today do take vitamin supplements and are unaware that you actually can overdose the stuff. So it's probably less a problem with the vitamin or the ingredients which we have in Kwai blood pressure, because first, potassium, magnesium are quite low dose. B vitamins are water soluble, so you can actually dose them quite high. Shouldn't pose an issue. The only ingredient potentially could pose a threat is iron, but iron is an active transport through the intestine, and it's also in there in a low amount, so I wouldn't be not so concerned with our composition. So it's quite in a good bracket, but nevertheless, it's important that you also check that people do not take too many vitamins and minerals, because that also could be very bad for you. So with this, I close and I give back to Lauren, who will go into the secrets of the 100 to 100 campaign. And I'm very glad look forward to hear her details.
Hi there. So going to introduce the campaign that Kwai are putting on for you guys. So they're offering a limited offer. So if pharmacy will purchase an outer of 5, which is 5 packs, at 20% off the trade price, which means £33.28 per outer. They will provide a marketing bundle to the first 100 pharmacies that sign up to be included as part of the campaign. That will include some targeted outreach. So that will be £73 worth of personalised to pharmacy letters that go out to 100 households within their walking distance of the pharmacy, which will be selected from the Kwai blood pressure target audience. This will be a letter which can be viewed, we'll show you a little later on, but also it can be viewed on the campaign page on NPA Connects. And as part of the bundle, that will also be some branded and co-branded with pharmacy social media assets and a web banner. So this means that it will have the Kwai information on, it will have info about blood pressure and get your blood pressure checked, but it will also have personalization to the pharmacy of pharmacy name, address, website, and so on. So the package is designed to drive awareness and footfall into pharmacy and to support any business growth. Also, as Jan mentioned, as well as, you know, offering the Kwai blood pressure product if patients are eligible, that will also drive footfall into your pharmacy for the NHS funded blood pressure checks. So how do you join in with the campaign? So after the webinar, probably tomorrow, you will get an email with a copy of this presentation and information on links to access the NPA Connect site, which will also take you directly to the blood pressure campaign landing page. Alternatively, you can get this from the campaigns drop-down area, and there'll be a banner on the website tomorrow as well that will lead you straight to it. So the page will look like this, some information at the top about the campaign and about the product. And then the first section that you'll need to complete is to order your blood pressure outer. So this will be confirming the pharmacy details here of where you want that pack to be sent. After that, we've got some information on the marketing bundle. You'll be able to click these to view them a little larger. And also here is where you will put your pharmacy personalization details. This is key because these are the names and addresses of your pharmacy that will be on the marketing materials. If you have multiple pharmacies that you want to sign up to the campaign, that is more than okay. You just need to ensure that you put the different pharmacy address information in these boxes here. In addition to the free marketing bundle that you get, you can order additional marketing materials to go alongside the campaign. That could be some leaflets or some posters that you want to display in store, and all of that can be accessed on the same page. Any of these can be viewed to be larger, and then you'll be able to preview your personalized details on the artwork as well. This is a copy of the letter. I don't expect you to read all the information now, but as I said, that will be shared after today's webinar. And it will have a QR code here that will go directly to a URL that you provide. So that could be your pharmacy website, or if you don't have a website, that could be a social media page or anything like that. And just here we have an example of the web banner. So we've got a few different designs with a few different lines here, facts, and different people on here as well. So you can choose from a selection.
Thank you very much, Lauren. What we'll do now is we'll stop sharing this PowerPoint show. I think it must be PowerPointed out by this stage, and we're going to answer some of your questions. If I can figure out how to get to the, here we go. So we're going to stop sharing now. So the panel is here and ready to answer any of your questions, if you may have some. So let's have a look at the chat. Bear with me a second. So what have we got? Bear with. Let me just have a quick look here. Okay, so the chat's telling me the chat questions were been disabled. So I think
I've got a few pre-submitted questions from people that couldn't make the webinar, so I could run through those whilst anyone has any questions that they then want to submit in the meantime.
That's a very good idea.
So one of the questions I had was, can I reorder more materials later and at what cost? So yes, all campaign materials will be accessible on NPA Connects. An A5 leaflet starts from 13 pence each, and A3 posters are from £1.06. All social media assets as part of the campaign are free. And in terms of later, someone else also asked a question of how long the campaign will run for. So it doesn't have an end date at the moment. However, only the first 100 pharmacies to opt in will get the free marketing bundle when purchasing 1 outer of Kwai blood pressure. But if anybody, of course, wanted to run any of the campaign materials after that, those 100 free have gone, that can also be funded by yourselves too.
Yeah, it's a great question coming back from Sanj, actually,
Yeah.
in relation to who sends the letter out. It actually comes from the perspective of the pharmacy. So this is a really key point. It's about building awareness of your pharmacy in your community. So the artwork will be branded as your pharmacy. You'll have all your contact details on. The QR code that's on there will link it directly to your website or your social media pages. So this is about ultimately and fundamentally, it's about driving footfall to your pharmacy and making people in your community aware of the types of services that you can do, so as we can build awareness of those services. So it's very much coming from your pharmacy, which is a very key point.
Just to add to that as well, where they've said me as the pharmacy, it won't actually be you as the pharmacist that has to sit there putting those letters into envelopes. We handle all that for you. So anyone that receives the letter, it will look as though it's come directly from the pharmacy, but we print and mail those on site here.
Yeah, they're produced professionally, and the beauty of doing it that way is that we produce 50,000 communications every single day, and so we funnel your communication through that distribution network. So it's a way of aggregating all of that through, so we can make it the most efficient, most automated solution for you. Okay, just another question on here too. Perhaps clarification on how you get patient data and target the correct population. Very good question again. What we tend to do is we work with data from one of the two leading data analytical companies in the world called CACI. They have data that is completely GDPR friendly, and they use Acorn profiling. So Acorn, you may know Mosaic from Experian. Acorn is a similar sort of process. So that enables us to be able to run some modeled filters that are relevant to the particular product and the services being offered. So for instance, Jan mentioned the fact that this would be very suitable for the over 55s. This will be very suitable from a kind of reimbursement perspective for pharmacy if we just target people over the age of 40. And so in a simple way, we can just make sure that we're sending the communication out to people that are most relevant for the service. But also we do that geographically. So we can also make sure they are the closest people to you, so that you're within a walk distance to that particular household. And so it's convenient. Okay, Lauren, have you got any more questions that we can share?
Yeah, absolutely. Someone has asked about NPA Connects and if there are any minimum order quantities or participation requirements. So there's no minimum order quantity on NPA Connects at all. But to be eligible for this Kwai blood pressure campaign, you must purchase an outer of Kwai blood pressure, but via the NPA Connect site. So that is the key part there. Just make sure that if you are purchasing one, it is through the NPA Connect site, so we can track that and then make sure that you're sent your free marketing bundle.
Excellent. And maybe a question for Jan?
Yeah.
Mhm.
So there was one from somebody on how does potassium contribute to lowering blood pressure, and in which patient population should it be used with caution? So I believe some of that was covered as part of the presentation, but if you could just touch on that again, Jan.
Yeah, let's start with the last bit. So when it should be used with caution is what I mentioned before, is chronic kidney disease, because excess potassium can have a problem with hypercalcemia there. But you know, if you have a patient with chronic kidney disease and they are diagnosed, because also here a lot of people are not diagnosed with chronic kidney disease, but they are diagnosed, they're very well managed, or they're aware and managed for that condition. Now, how does potassium work in lowering blood pressure? It is, first of all, enhances the excretion of sodium, which is a very well-known trigger to increase blood pressure, but also it has an effect on muscular tone and vascular resistance. So that's how actually it works to reduce high blood pressure on the effect it has on the vascular system.
Thank you very much. Any more, Lauren?
Yeah, I've just got one question here on, do I need an NPA Connects login to access the campaign resources? The answer there is yes. NPA Connects is a benefit as being an NPA member. Everybody should previously have been emailed with a link to activate your account. If you haven't had that, not to worry. When we share the presentation, we will also share a link on accessing the site and details on how you can activate your account if you haven't already.
Fabulous. Thank you very much. I think that's as many questions as we've got come in from the panel and pre-sent to us before the session. So
I know we had a bit of issue to start with the question section in the webinar. If anyone has any questions afterwards, please email getintouch@npaconnects.co.uk and we'll be able to answer any questions that you weren't able to submit or that you think of afterwards.
Absolutely. And this is very much a product that's been designed, delivered for you as independent pharmacies across the UK. And your feedback is extremely important to us, and how we model the product going forward is extremely important to us. And so we will continuously looking to get feedback from you, and we're continuously looking to work with people like Jan on who's going to create some solutions that will enable you to kind of offer remedies to your community on an ongoing basis. The other thing is, from a team here, we're really pleased that you could join us this evening, because it is a very warm evening, and to take the time out to attend this webinar is we're very grateful for you doing that. So Sanj, we're going to hand back to you to do the finish the bookending for the session.
Yeah, no, that's great. No, thank you so much to Gary, Lauren, and Jan for that. I think for all of the members that have joined today, vitamin and supplement field can be a minefield. It's a growing market, it's a growing industry, and it's really important that our teams are well educated, they're trained, and they've got the right support from essentially a trusted, reputable company that can support you. Because patients will be asking you questions, and I think you can see the knowledge and what Jan's showed us today is that they can definitely help support with that. And like I said, it's not a substitute for healthy, balanced diet, but they do have a place, and many patients do look for this kind of supplemental support before having to get prescribed any medication. So it's a really good initiative, and I think the NPA Connects program there with Kwai is there to really make sure that we can maximize our reach to patients in the community, get that footfall through your doors, and you can deliver these services, especially with the hypertension case finding services. But that opens up that avenue to so much more for what we can deliver to patients. So it raises your profile. It's a really good initiative, and like I said, it's all branded to yourself. So I hope that's been a really useful webinar for you, and I hope it's something that everyone can engage in. NPA website has got more information about the NPA Connects program and this initiative is here as well. So as always, any questions, email them across to us, and we're always more than happy to support and help. Thank you very much for that, everyone. And I will leave you to enjoy the lovely evening that you've all got then.
Thank you. Have a good
Thanks
night.
a lot. Have a good evening. Bye-bye.